Hi guys, in today's session we are going to talk about stapler circumcision. Okay, now what is the stapler circumcision? Uh, I'll explain you what exactly is this. This is basically a newer method to do a circumcision. Okay, now I understand that all of us do circumcisions traditionally by what you call as applying the artery clamps, the straight artery forceps, then cutting it till the coronal glands, and then cutting everything around. Okay, this is what is a traditional circumcision which we all have been taught during our MS general surgery residency. Then there is another method of doing a circumcision is what is called as a sleeve technique. Sleeve technique. Have you ever heard of this? Now, I will not be mentioning a lot about the sleeve technique on this particular session, but what you need to understand, this is also a very nice method of doing a circumcision. In this, what you basically do is that you leave the dartous layer behind. All you basically dissect is the skin till the corona. Okay, and then you cut that just the superficial skin. So you basically do your dissection between the skin and the dartus. That's what you do. Okay, and then you kind of get rid of the skin and the dartus basically coils back. This is better in a way because the bleeding is a bit less and you're leaving the dartus behind, which is obviously better. There's no rule of or no point of removing the dartus. Okay, so if at all you can catch hold of some particular video of the sleeve technique, just have a look at it. It's something which is a really good way of kind of doing a circumcision as well. Now in the last 3 to 4 years, uh, circumcision has kind of also gone to something which is called as a stapler circumcision. Now when you start your private practice or something, many times patients might come and ask that, you know what, do you do a circumcision with the stapler or something like that? Okay, then in that particular scenario you should be at least aware of it, right? So let's try to understand it. Okay, so like any particular stapler, this is the device which you basically get. Okay, so this is basically the external apparatus, whatever you want to call it. Okay, and then this is a part, the anvil kind of thing, which goes inside the what do you call as a glans and the prepusal skin. Okay, so I'll talk to you about this. Okay, so this is how the stapler looks like. Okay, now just pay attention over here as well. This has a rule. I will talk to you about all these particular things. This is a screw. Okay, so what is this? This is a screw, like you screw and like tighten and you relax this particular stapler. Then this is what you call as a stopper. If you put this, you will not be able to fire the stapler. And once if you want to fire the stapler, you have to remove this particular thing. This is an anvil. This is what is the stapler body. Okay, now it includes two parts. The inner bell, the anvil is basically called as an inner bell. What does it do? I'll talk to you about this. It basically helps in protecting the glands. Okay, it helps in protecting the glands and the outer bell. So this big body is something which is called as an outer bell, and this is what is your inner bell. What is this? Inner bell. Okay, now the inner bell is designed to protect the inner glands. So what does the inner bell do? It basically protects the inner glands, and the outer bell consists of the blade to cut the foreskin and staples to close the wound for simultaneous hemostasis. So the stapler work exactly like any other stapler would work. When you fire the stapler, the staples are going to come, they're going to cut the skin, they're going to cut the kind of subcutaneous tissue, and yeah, the stapler is going to be fired. The hemostasis has would be achieved as soon as you fire the stapler. So this is how it actually works. Okay, but yeah, let's kind of look at it. Okay, now there are various sizes of the staplers which are available. Once you open the stapler, that you have to use, right? So before opening the stapler, you need to understand that which size the stapler has to be used, right? For that you have this particular scale. Okay, now please pay attention. How do you measure this size? Okay, so you have to measure it at the level of the corona. Okay, the coronal sulcus, you have to kind of measure it at that level. Are you able to appreciate it? So what you do is you pass the scale through the penis, and if at all the scale easily goes through that particular coronal sulcus or something like that, that is the size where like which stapler you have to take. Okay, are you able to understand this? If you take the stapler of this size, this size, this size, it will be shorter. You will do a partial circumcision if you use a smaller kind of stapler size. Okay, so it's self-explanatory. The image is self-explanatory. This is how you measure the size, what stapler size has to be kind of used. Okay, so the size of the penis just above the glans is kind of measured. That's fine. Okay, so just above the coronal sulcus, the glans, this has to be kind of measured. Okay, then After, okay, you apply the povidone iodine and everything, then what you do, you apply the local anesthesia. So what is this particular local anesthesia? What you basically do is, okay, so many of the surgeons prefer to do it under what you call as a spinal anesthesia, or let's say general anesthesia or something like that. But it can also be done under local anesthesia. In local anesthesia, you have to give a really good block. That is something which is absolutely essential. But most of the times, people prefer to do it under, let's say, the spinal or some kind of general anesthesia or something like that. Okay, please try to understand this. Okay, so after disinfecting the penis with the iodine or equivalent, the dorsal nerve block and the circumferential block are done with 1% lidocaine. Nothing specific about this. The way you basically give the penile block, you basically give this. Okay, that's fine. Understood, right? So it can be done under local anesthesia as well. Okay, then what you do, you have to catch hold of the prepuce, and what is this? The surgeon is basically holding the inner bell. Okay, so what you basically do is this inner bell is basically passed through the kind of prepuce inside. Okay, so this inner bell is passed from the prepuce inside. So inner bell is placed inside the foreskin of the prepuce or of the penis to cover the glans. Okay, so you pass this particular inner bell, and this basically covers the glans. Okay, the edge of the bell is brought to the level of the coronal sulcus. So as you can understand this, are you able to appreciate this, my red mark? Okay, so I'll just highlight it. The edge of this bell, this is a bell. Okay, this is a bell. So the edge of the bell is brought at the level of the coronal sulcus. Okay, I hope you're able to appreciate this. The edge of the bell is brought to the level of the coronal sulcus. This is something which you need to understand. In case where the patient is suffering from the phimosis, or dorsal slit has to be made correctly, the position of the inner bell and the stapler. Are you understanding my point? So many times, if at all the patients are having a very, very dense phimosis, how will you place this particular inner bell? You will not be able to place, right? So then what you have to do is you have to perform slight dorsal slit, because only then you will be able to place this particular inner bell. If at all the prepuce is slightly lax, you will be able to place this enable very easily, no problem. But if at all it's a dense phimosis, then the dorsal slit might be needed in order to place this inner bell. That is something which you need to understand. Okay, now after you have placed this inner bell, so what you basically do is that after you have placed this, you tie this. Okay, so whatever the prepusal skin is, you basically tie it very, very nicely to this particular inner bell. Okay, so the metallic rod of this inner bell, you basically tie it. Okay, understood? So the edge basically goes to the coronal sulcus, it protects the glans, and then you tie the skin over that particular metallic rod. Okay, now you come to the outer bell. So there's one cover on the outer bell, you kind of remove it, that's all fine. Okay, so the safety shield that removed from the outer bell, that's all okay. Okay, now after that, are you able to appreciate this yellow colored stuff? So this yellow colored stuff is something which is called as a it basically is a stopper. If you do not remove this, what is going to happen? You might be like, you will not be able to fire this particular stapler. So you can remove it at this point, or you can remove it at a later point as well. Okay, so I prefer to kind of remove it at the, okay. So what you do is that once you have removed this particular safety shield, then what you do, you place this outer bell onto the middle of that inner bell. Are you understanding my point? So what we had was that the inner bell was at the coronal sulcus, and the prepuce was tied over here, and this was the middle, right? So what you do is you put your outer bell over that particular portion, and once you have reached this edge, has reached to the edge of the inner bell, now what you do is you have to tighten this. Okay, so what you need to understand is that you can tighten this, or you can, at this point, you can remove this particular safety cover. Okay, so the outer bell is placed over the inner bell while the frenulum is kept intact. Frenulum is kind of kept intact. The safety bolt of the stapler is then removed. Are you understanding? So this yellow colored thing, that is what is the safety bolt. Then what you do is, okay, so this black colored knob you're seeing, you need to screw this particular stapler. Okay, so the screw on the top of the stapler is then rotated clockwise to sandwich the foreskin tightly. Okay, so now what you do is you can screw this particular stuff clockwise so that the skin gets compressed. This is similar to any particular stapler which we have, right? Any stapler, we have to tighten this particular screw. So you tighten this particular screw so that the skin is compressed between the two edges, and then